Cummings and I'll make our opening statements, then we'll recognize you for your opening statements. Our country is in an opioid crisis, and it's getting worse. Statistics can be helpful because statistics help us quantify and provide scope and scale, but statistics are what usually happen to other people. What paints the most vivid image of this crisis are those who have lost children to overdose, those who are now and will forever be in the throes of addiction, and those whose lives have been ended, upended, and are in fear of retreat back toward addiction. The increasing reality is more and more of our fellow Americans have come face to face with this crisis within their own families, to say nothing of within their own communities and the broader American family. Each year, over 64,000 Americans die from a drug overdose, and that's more than the number of Americans killed in the entirety of the Vietnam War, a war which has consumed parts of the American consciousness for over half a century. And while consensus exists on the depth of this challenge and the need to confront it in an apolitical way, the problem is worsening as more potent drugs emerge and the online market for illicit distribution expands. Our country is in desperate need of a central coordinated response. The issue knows no geographic boundary, is no respecter of state lines, which means we need a coordinated governmental response at the national level. So 30 years ago, Congress created the Office of National Drug Control Policy. This office is designed to play a central role in coordinating the nation's drug control policy and programs. National drug control efforts are spread across 16 departments and agencies implementing programs and operations throughout the U.S. So a central coordinating body is essential to ensuring effective evidence-based drug control programs. Drug control efforts should be synchronized and targeted at achieving specific strategic goals. While the ONDCP continues to receive annual appropriations from Congress, it nevertheless operates under an expired authorization. Reauthorizing ONDCP with revamped and enhanced authorities will improve coordination and effectiveness of federal agencies and their diverse drug control efforts. ONDCP is also tasked with administering 2 grant programs, HIDA and the Drug-Free Communities. ONDCP is uniquely positioned to administer these programs in a way that gives those working at the state and local level a prominent seat at the table. As Congress appropriates increasing levels of funding, the need for national coordinating office is more important than ever. And to be sure, our nation's drug crisis will not be curtailed merely by appropriating money. The money must be spent in an effective way rooted in evidence, experience, and expertise. Last week, our committee shared a discussion draft of reauthorization text for the ONDCP. The committee has held hearings, roundtable discussions to better inform our reauthorization efforts. And through the posting of our draft text online, we've received constructive feedback from the general public. Today, we want to hear from partners about the importance of reauthorizing ONDCP. By ensuring a synchronized national effort, we're better positioned to achieve our common goal of ending this devastating crisis. This week is the week we set aside each year in Congress to honor law enforcement. So I want to end by honoring someone in law enforcement, an old narcotics officer by the name of Kevin Simmers. Kevin dedicated his career to the interdiction and detection and apprehension of drug dealers. He wanted to do his part to keep his community free from the scourges of addiction and trafficking. He felt like he was doing the Lord's work. But Kevin was not just a law enforcement officer, he was also a father to a beautiful daughter named Brooke. But we know addiction is no respecter of people, not even of law enforcement officers who dedicate their lives to keeping drugs away from other people's children. No one is immune. So when Kevin's daughter, Brooke, developed an addiction, he did everything a father could do. He tried treatment. He tried unconditional love. He tried tough love. He tried treatment again, even tried jail. You can imagine how hard it would be for a father to leave his daughter in jail. But he did so because he wanted her to be clean. He came home from work and parked his police car behind his daughter's car so he could block off not just her car, but also her path back to addiction. He wanted to keep his daughter from leaving in the middle of the night. He wanted to separate her. He wanted to protect her. He wanted to trap her. A father's love can be a benevolent trap, but heroin is a trap too. So Kevin woke up one morning to the ominous sound of an empty house and the ominous sight of tire tracks through the front yard. His little girl was gone again. 6 o'clock in the morning. Brooke went to a gas station. She called her sponsor. Sponsor said, call your dad. But she didn't want to disappoint her father again. So she drove to a church where she played basketball as a child, crawled into the back seat of her car, and overdosed on heroin. It's not the statistics. It's not the money. It's something you can't count. It's the grief of parents burying their child. The gentleman from Maryland is recognized.
Thank you very much, Mr. Chairman. The first overdose death that I heard of, I was 6 years old. 6. I'm 67 now. And this young man was a hero in our neighborhood. And I didn't even know what drugs were. Then I had an opportunity later on in my life as a 15-year-old working in the drugstore to watch people come in trying to get Robitussin. You remember that? Trying to get high. People that were in so much pain, they didn't even know they were in pain. Of all colors. That was 50-some years ago. And I am glad that we are moving to this moment because I do believe that this is a destiny moment where we say enough is enough. Fighting the opioid epidemic has been one of my top priorities for several years. Had a family member to die from this. Not only because it's the terrible thing that has destroyed so many Baltimoreans' lives, but also because it's devastating a nation. In red states, in blue states, and purple states. It is time that we finally recognize this epidemic for truly what it is. A national emergency that is killing 115 Americans every single day. 115 and counting. In December, the Centers for Disease Control and Prevention warned that life expectancy in the United States dropped for the second year in a row, and drug overdoses are the single biggest reason why. In 2016, nearly 64,000 Americans died from drug overdoses. These numbers are only getting worse with every passing minute. I understand that today's hearing is supposed to be about proposals to reauthorize the Office of National Drug Control Policy. But it's hard to do that when we have not been able to speak to the acting director of that office. We asked for him to testify here today, but our request was denied. It's also hard to do it when we will not be hearing from other stakeholder agencies that are involved in this fight, like the DEA and the Coast Guard. We're supposed to mark up a bill next week, but we have not received any official feedback or technical assistance from the administration. We had a roundtable meeting with ONDCP staffers, and I thank you, Mr. Chairman, for that. But I'm concerned that this legislation may not be ready for prime time. Compounding this problem is the Trump administration's total lack of leadership on this issue, and they are simply missing in action. The National Drug Control Strategy was due in February, but they did not submit one. Remember what I said. We got 115 people dying a day, but no drug control strategy. Now the president has just assumed office. I got that. So maybe it is understandable. But this February also came and went, and he still has not submitted a strategy. 115 people dying a day. ONDCP staff told us that Kellyanne Conway is calling the shots. I sent a letter to the chairman on February 16th, 2018, asking for a briefing from her or anyone from the White House who could tell us what's going on. But that never happened. Ladies and gentlemen, this is the most deadly national health crisis we have seen in 3 decades. In 3 decades. Where President Trump has shown no leadership, Congress must step into the void and demonstrate a bipartisan commitment to taking on this fight in an effective and efficient manner. We can talk all we want about how we might want to reorganize ONDCP, require new reports, and reshuffle the lines of authority. But they are not doing their jobs now. They're already failing to do what Congress required. So I have little hope that these kinds of changes alone will make a difference. Here's the main point I would like to convey today, and I would like to place it in the DNA of every cell of our brains. Reauthorizing ONDCP is an important step. We want to ensure that we have a coordinated, effective, and efficient and evidence-based strategy. But rearranging the deck chairs is not enough. Nibbling at the edges is not adequate. If someone has a gaping wound, we cannot just slap a Band-Aid on it. If someone is fatally hemorrhaging, we cannot just hand them a new organizational chart for a government office. They need expert medical care. As a nation, we need to dedicate significant and sustained new funding for treatment to combat this epidemic. The Department of Health and Human Services estimates that more than 2 million people in this country have opioid use disorders, which is likely an undercount. Yet, only 10% are able to access the specialty treatments they need. Imagine 10 people with cancer, and you tell them that only one of you can get the treatment in the United States of America, with one of the greatest health systems ever found. Something is wrong with that picture. We cannot stop this crisis if 90% of those affected cannot be treated. Last month, I introduced the CARE Act with Senator Elizabeth Warren to start treating the opioid crisis like the public health crisis it is. Our bill is modeled directly on the Ryan White Act, which Congress passed with bipartisan support in 1990 to address the AIDS crisis. It has been endorsed by more than 30 organizations, including health advocacy groups, nursing organizations, local government associations, and public health organizations. I urge all of my colleagues on both sides of the aisle to join our bill. My staff has already contacted each of your offices and my door is open to answer any of your questions. To conclude, I want to thank our witnesses for being here today, including Ms. Goodwin from GAO, Mr. Parikh from the Bipartisan Policy Center. I look forward to hearing from Mr. Carr, an old friend and the executive director of the Washington-Baltimore HIDA Intensity Trafficking Area. I appreciate his effective leadership, and I thank him for his endorsement of the CARE Act. Finally, I thank Commissioner Gupta of the West Virginia Bureau for Public Health for joining us today. And as I close, let me say this. This is our watch. This is our watch. And it is our duty to protect our neighbors. I think the chairman said it quite eloquently. We've got to do things to protect our neighbors, and it will affect all of us. There was one time that it seemed that the only place that was affected was the areas like the ones that I live in today and lived in for 35 years, the black community. Well, hello, that is a big difference now. It's everywhere. And so we have to address this in a bipartisan way, and I'm looking forward to it. And Mr. Chairman, I want to thank you for working with me and for your indulgence.